One bite, just one little bite, can have such a big and often tragic impact on a child's life. Malaria. It's a disease that threatens half of the world's population, and is contracted from the bite of just one little mosquito. One bite can wreak so much havoc, and yet in areas where compassion is working, there are children who receive 1,500 infected mosquito bites every year. From Bangladesh to Brazil, Togo to Thailand, Nicaragua, Uganda, Sri Lanka, and all the countries in between, malaria is a very real threat to so many of Compassion-sponsored children. And it breaks my heart that a child still dies of malaria every 45 seconds. And 90% of those deaths occur in sub-Saharan Africa, where I spent my childhood. Malaria affects the poorest areas the most. Treatment is too expensive, bed nets are often non-existent. This is a personal battle with me. I grew up in that little village where malaria was a constant threat around us. The buzz of a little mosquito was not just an annoyance, it could be a death sentence, and we knew it as little children. Many of my little friends died to this horrible disease, some of them right in my arms, taken away from all of us just way too soon. In Uganda, children walk to local watering holes to collect water, and these places are prime breeding grounds for mosquitoes. In northern Bangladesh, stunning, lush tea gardens cover the rolling hills. However, those who work among these plants in that beauty are at the greatest risk to contract malaria. As Compassion focuses on helping children develop holistically, malaria is a threat that we simply cannot ignore.
Every time a child gets sick, it will affect not only the child, but also the whole homestead. As for the child, that means they will not go to school, their school attendance will decline, and that will impact a lot on their performance.
So you might ask, what are we doing about it? Well, around the world, Compassion Project staff and volunteers are educating families about how to prevent this disease. In villages in Bangladesh, a malaria prevention team teaches people how to keep mosquitoes away from their homes with tips as basic as just shutting the windows at dusk. In Uganda, people are meeting in classrooms and under shade trees to learn how to keep their families safer by simply cutting the grass away from their huts and throwing their rubbish further away from their houses. But undoubtedly, one of the most effective ways Compassion is preventing malaria is through the distribution of bed nets. Did you know that the use of bed nets has been proven to reduce instances of malaria by 50%, cut in half?
We have distributed already more than 15,000 mosquito nets to the community people.
This year, Compassion distributed over 27,000 mosquito nets to children. About 68% of all our children today have mosquito nets. This is above the national figure of about 35%.
Even more exciting, Compassion Uganda saw a 50% deduction in malaria cases among their sponsored children in the last 3 months of 2011. This last year alone, Compassion has distributed tens of thousands of bed nets to families that otherwise could not afford them but desperately need them. So through these efforts, more and more Compassion children all over the world are having a much better likelihood of keeping their families safe from malaria, allowing these little ones to focus on things much more important, like going to school and playing, and all the other important parts of being a child. And so by now you're probably wondering, what can you, one person, really do to make a difference in a challenge that is so global, so huge, so massive? Well, I remember wondering that kind of a question in my little village when I was a boy. We used to have a proverb that we used often. If you think you're too small to make a difference, well, try sleeping with a mosquito in your hut.
Nazampa akatimba ekishaddamu kulwala.
Nina essanyu ppitirivu olw'okuba nti nfunye akatimba kano era nkakasa nga omusujja gw'ensiri kati ngugobedde.
স্পন্সর আপনাকে ধন্যবাদ, আমি এখন ম্যালেরিয়া থেকে মুক্ত হয়েছি।